my gosh, I can't believe I actually did that. I was dreading that actually. That could have gone so much worse. So I'm gonna say fantastic. All right, what's up guys? It's Wednesday, time for more PT from your favorite PT. Okay, so I got a question or an ask the other day about how I sit like this without destroying my knees. Now, I'm gonna say, first of all, I've never really had knee issues, so that's helpful. Also, I'm kind of one of those weird sitters, right? Like I always kind of sit with my legs sort of bent up or tucked up or around. So I've never really had issues with it. Plus the line of work that I'm in all day, I'm kind of stretching all day as it is. But I do have patients who've come in who've had knee replacements or knee surgeries or injuries where they're limited in their range of motion. And the range of motion is, right, the straight, that's knee straight, that's knee bent, and that's your range of motion. You should have between 0 degrees, which is fully straight, and 130, 140 is kind of average. It depends on the size of the muscle bulk here, because that's what's stopping you. But one way to work on knee flexion, which is bending, is if you're on your hands and knees, which I know is not always easy for people who have knee issues, especially with knee replacements and things like that. Getting on your hands and knees is not always easy. However, if you have a carpet or a pillow or something you can get on, it does help. Not initially, right after surgery, waiting a little bit till the incisions have healed, but getting on your knees also helps with the sensation, from the incision sort of down the front. So there's a couple issues you have to be careful with this one. However, without surgeries and just sort of a little bit of knee tightness, you get on your hands and knees. Sometimes I'll have you sort of tuck your feet underneath, because sometimes people get cramps in their feet, or you kind of do it hanging over like the edge of your bed, so your feet are hanging off the edge so ankles aren't getting in the way. My feet are about hip distance apart, or my knees are about hip distance apart, okay? And so from here, you're just gonna sit back, right? And you'll go as far as you can. Pain-free, stretching, tightness, okay. Pain, sharp, stabbing, burning, throbbing, not okay. All right, so we're here, right? And you're just using your body weight, right? The weight of my body to sort of push back until I feel a nice bend in the knees, right? And you come up. So with this, you'll hold for about 5 to 10 seconds, depending on how intense it is for you. And you're gonna do 2 sets of 10 of those. And then you sort of keep, if you can, the next time lower a little bit further down, right? So you're going to continue to do that, and hopefully, eventually, you can get to there. Now, there are also some hip restrictions that can also limit some of that movement. But for now, that is one way to help increase knee flexion range of motion. Good luck, have fun. Happy Wednesday.